Welcome to our Leadership Gala. Now, some of you may be wondering why we're doing this in July, right, instead of our usual in June. But things got so busy in July, and we had to squeeze in so much that we decided to extend June into July. Now, things are still busy, and we don't have enough time in the day or days in the week, so we'll be having our holiday party in March of 2012. Okay. In my next life, I'm working on being a stand-up, so I just want to check the laugh factor. Okay, anyway, but seriously, in case you haven't noticed, we're in a time of radical change. Anybody not notice that? In our field, in behavioral health and in health, and the combination of state, local, federal budget deficits, federal healthcare reform, and the fact that 5% of the population is using 80% of behavioral health and health dollars has really created a flurry of activities around systems change. This environment became fertile ground for, I guess, what many people are now calling disruptive innovation. In broad terms, right, the goals are cost containment, improved outcomes for individuals with behavioral health challenges, and the delivery of coordinated health and behavioral health services. While there are many managed care and different kind of waiver models that other states have implemented, nothing is quite like New York. At least that's what us New Yorkers say, right? Especially with my accent, right? While we understood the need for change, and we understood that the current system was unsustainable, few would argue that our system of behavioral health and health services did need some reform, and the statistics are pretty, not pretty. None of us would have predicted the rapid timeframes before us. We can kind of argue about the respective benefits of incremental change versus rapid-fire adaptive change, but we had and have no choice but to mobilize, galvanize, and organize our best thinking and strategies to influence the present and the future. And now, depending on your own personal tolerance for change, it feels more like who stole my cheese than who moved my cheese. But well, mobilize we did. The community providers, consumers, families, and government partners responded to the initial MRT proposal to carve in all behavioral health care into health managed care effective immediately. As a result of our collective efforts, we won the opportunity to influence the design of the future system of care, and perhaps more importantly, to ensure that what is really working is not lost, and that the behavioral health community's added value to address the needs of the most vulnerable is recognized and utilized in the redesign effort. The importance of that win cannot be overstated, but premature triumphalism is not in order either. There's still a lot of work to be done. Long before the MRT proposals, many providers were already trying to address the complex health issues and the health disparities for people with behavioral health challenges, introducing person-centered, integrated, evidence-based approaches, self-directed wellness approaches, substance use, integrated substance use and behavioral mental health, and peer services and high-touch engagement for individuals who are falling through the cracks. But now is the time to translate that vision and some of our efforts into action and recommend how the systems barriers need to change, regulations, licensing, and financing to advance and incentivize effective, coordinated, integrated, collaborative care. Now is the time to ensure that the redesign, through both systems and practice reform, addresses the needs of the most vulnerable. This evening, we are honoring leaders. For all its promise, leadership is risky business. Ronald Heifetz and Marty Linsky, I don't know if any of you have read this, the Leadership on the Line. They talk about leadership as dangerous business. They write that adaptive work creates risk, conflict, and instability, because addressing the issues underlying adaptive problems may involve upending deep and entrenched norms. Leadership involves disturbing people. So the task of leadership is often to mobilize people to adapt to a world with different constraints and opportunities than they have imagined. Sounds familiar? Today we live in a world where the stakes are high, time is compressed, and uncertainties are great. Yet there is both an abundance of risk and abundance of opportunities. So the coalition, its staff, and its leaders, Philip Sapiri and Pat Gallo-Goldstein, are helping us navigate some very pitchy waters. And I just want to acknowledge the coalition staff. If they could just stand up and let's give them a hand, because they have been working incredibly hard. It's unbelievable. They have been working tirelessly in a fast-paced environment, learning, studying, advising, educating, and proposing innovative approaches and designs to advance the interests of the coalition members, and by extension, the people that we serve. They have been facilitating provider collaborations and enhancing provider capacity through both the coalition and through the coalition's Recovery Center. So we've been front and center advocating for what we consider essential elements of any redesign effort that promotes quality integrated care. So to achieve our goals, we must not only redirect dollars from high-cost services, but ensure that the overall system of services is adequately financed. Housing, of course, will be critical in addressing the needs of the super-utilizers and high-utilizers of ER and inpatient care, many of whom are homeless, or as we say, precariously housed. Safety net services, not just Medicaid managed care, will be important if those services that address the social determinants of poor health and behavioral health will be critical to our success. And to be successful, providers will need to change, to be nimble, innovative, and collaborative. We will be judged by the evidence of outcomes. So, in this big picture of policy discussions about managed care, carve-ins, carve-outs, RIOs, health homes, medical homes, accountable care organizations, capitation, PMPM, and case rates, we must remain faithful to the thread that binds us. For us, it should always be about supporting people toward recovery and self-determination. Or in other words, helping individuals get off the behavioral health care bus, have a life, and achieve their dreams. So, thank you.